Systematic Literature Reviews. Professor Monder invites you to a lecture. You've likely heard of systematic literature reviews, but what do they really mean? And how do they fit into medicine and health technology assessment area? For healthcare professionals, staying updated on the latest research is crucial. Yet, with the constant increase of published studies, it's nearly impossible to read and evaluate them all. Systematic literature reviews, referred to as SLRs, provide a valuable solution. They are a summary of scientific evidence, answering specific questions in a clear and reproducible way while spotting data gaps. This form of secondary research is well organized and adheres to explicit rules established at the project's outset. They include all published evidence on the topic and evaluate its quality. SLRs, especially clinical ones, often employ some statistical magic to combine the findings from different studies, providing a more robust and comprehensive understanding of the topic. It's no wonder that the count of systematic literature reviews is skyrocketing each year. SLRs have become a cornerstone methodology, especially in fields like public policy research and health sciences. They serve as a critical tool for healthcare professionals aiming for well-informed, evidence-based decision-making, especially in contexts like drug reimbursement. They summarize the effectiveness of treatments or diagnostic methods and provide the most valid evidence base to inform the development of trustworthy clinical guidelines and improve patient outcomes. Additionally, SLRs help identifying gaps in existing knowledge, highlighting areas that demand further research. This helps researchers and clinicians in developing new studies to address unanswered questions, fostering progress in the field. What's the process behind developing systematic literature reviews? Let's break it down into 4 parts. When planning an SLR, researchers needs to clearly formulate the research question that will ensure his work produces relevant results. Based on the question, they need to formulate the PICOS. Population is a description of a group of participants and their clinical problem. Interventions are the main actions being considered, for example, treatments, social intervention, educational intervention, risk factors, tests, etc. Comparators stands for actions for which the comparison is being considered. Outcomes are results of the studies being included into the SLR, and can be different depending on the type of review: clinical outcomes, costs related to the disease, changes in patients' quality of life, etc. Study design precisely defines the study types to be considered, aligning with the review's unique topic and objective. Once the PICOS criteria are established, researchers must choose the databases and run searches. The process involves combining keywords in a manner specific to each chosen database. It demands attention and focus, as it significantly influences the assurance that no relevant studies are overlooked. Among the key and widely used sources are databases like Medline, Embase, Cochrane Library. In addition to databases, researchers can explore gray literature. It encompasses materials that are either unpublished or released in non-commercial forms, including clinical trials registries, HTA agencies' reports, speeches, and conference proceedings. Omitting gray literature from a systematic literature review is inappropriate, as a thorough search aims to be as comprehensive as possible, minimizing the risk of publication bias. The PICOS criteria, search strategies, and a description of the methodological approach for the subsequent steps of the SLR should be presented in a crucial document named Search Protocol, because it enables researchers worldwide to replicate or update the work done, ensuring transparency and reproducibility of the review process. In the second phase of the systematic literature review, researchers perform a dual study selection process. First, they analyze the titles and abstracts of identified records, followed by an in-depth review of the selected full texts. This meticulous process involves two independent reviewers to ensure accuracy, minimizing the likelihood of errors. Any discrepancies between reviewers are resolved through discussion and mutual agreement, or, if necessary, the intervention of a third researcher. Today, researchers can use artificial intelligence-supported tools that streamline the SLR process. These tools assist in tasks such as ranking references, giving priority to those most likely to meet inclusion criteria, and making the review process more efficient. In the third phase of the SLR, researchers move on to extracting data from the included sources and conducting a quality check. To ensure the reliability of the identified data, various recommended tools are employed to assess the quality of the studies. The final step of the review is data interpretation and reporting. When summarizing the findings, maintaining objectivity by avoiding emotional phrases and personal opinions is crucial. The summary should be logically organized and structured, including a section with conclusions, key messages, and a thorough examination of the review's limitations. Doing a systematic literature review takes time and attention to detail. It can span from a few months to over a year, depending on factors like the complexity of the PCOS, the volume of published studies, and the resources available. It's crucial to prioritize quality over speed to ensure the findings are valid and reliable. Wondering when to consider a systematic literature review? Easy, every time you want to make evidence-based decisions. By gathering information from various independent studies, you boost the reliability and applicability of the findings. This is particularly handy when there's a wealth of research on a topic and you want to get a clear picture.